blood cultures to begin with. So for collection of blood culture, you need to ensure proper skin preparation and disinfection to avoid contamination. And each blood culture set should include one aerobic, one anaerobic bottle. This is very, very important. Whenever you collect blood culture, you always collect in the form of sets. You don't collect a single culture. So it should be one aerobic and one anaerobic. So this collection of anaerobic bottle is very, very important because majority of the bacteria, even if the bacteria is aerobic, they tend to grow faster in anaerobic conditions. That's why that point is very, very, very important. Just hold on a while. Sorry, guys. Okay, let us continue from where we left. So how much blood culture sets you have to collect? So before starting empirical antibiotics, try to always collect at least a minimum of 2 sets, which means 2 aerobic, 2 anaerobic, and this should be collected from different sites, separate sites, not from the same site to avoid contamination. And how much you can collect? You can collect up to 3 cultures per day. In case if you're suspecting intermittent bacteremia, this is especially due to an undrained abscess. Okay, so if you suspect intermittent bacteremia due to an undrained abscess, you can collect up to even 3 cultures per day at different times from different sites. And adequate volume is very, very crucial because if you have an inadequate blood volume, it may actually miss out on bacteremia. So try to collect adequate volume. How much volume is recommended? Ideally 20 ml per set, which means 10 ml per bottle. So 10 ml for aerobic and 10 ml for anaerobic. So this is one set. Okay, so 20 ml is one set. So the 10 will be for aerobic and 10 will be for anaerobic. So that is what is ideally recommended in most situations. In case if you're dealing with a child, then you can use some weight-based classification systems as well. And most of the guidelines say you have to collect 1% of the blood volume. Honestly speaking, you have to collect 1% of the blood volume. So if it's a kid, and maximum of 5 ml per bottle is what is recommended if it's a pediatric age group child. And coming to the interpretations, you have to know some of the common contaminants with regards to blood culture. So it can be kind of anaerobic gram-positive cocci. That is something that we have discussed a while ago. Most of the bacillus species, we take it as contaminant. And coagulous negative staphylococcus, except Staphylococcus lugdunensis, this can cause virulent infection like Staph aureus, except that one particular bug, Staphylococcus lugdunensis. Most of the cons like Staphylococcus epidermidis has to be taken with caution because most of them are skin commensals and they can contaminate your blood culture, resulting in contaminant samples. And then we have coroniform gram-positive rods. So even most of the coroniform gram-positive rods, not actually the Corynebacterium diphtheria, the coroniform rods. So they are basically kind of contaminants. And lot of non-pathogenic Neisseria are there. In case if you're culturing Neisseria meningitis or Neisseria gonorrhea, that's definitely going to be a non-contaminant. But if it's going to be Neisseria of non-pathogenic group, except the meningitis and the gonorrhea, so definitely it's very likely to be what? A contaminant. Okay. Then we have the viridans group Streptococcus. So this is kind of pathogenic in hemato-oncology patients. So viridans group Streptococcus sometimes may be a contaminant because this is also kind of a dental organism, oral organism. So there are a lot of subgroup of organisms under this viridans group like Streptococcus mutans, Streptococcus mitis, Streptococcus aeruginosus, and so on. So all of them are very likely to be contaminant unless and until you have a strong suspicion of this bacteremia from these organisms. So these are likely contaminants in blood culture. Make a note of it. And then there are certain organisms that are associated with gastrointestinal neoplasia like colorectal cancer. The most important is going to be Streptococcus galolyticus, which was previously called as Streptococcus bovis. Then we have the Streptococcus infantarius and Streptococcus alactolyticus. And then we have the Streptococcus lutetinensis and we have the Streptococcus equinus, all of them formerly called as Streptococcus bovis. Currently, we don't use the term Streptococcus bovis. Rather, in exam, they will give the term called Streptococcus galolyticus. And then we have Clostridium septicum, so which is also linked to hematological malignancy, and they're going to produce a kind of a swarming motility on your colonies in agar. So that's a clue, the swarming motility. So that's how we remember the Clostridium septicum is going to have a swarming motility. So S for S. So that's how you remember it. And then a lot of organisms can result in false negative cultures. One of the most common reasons for false negative cultures is insufficient blood volume. We don't take 20 ml. So that's the most common reason. Apart from that, use of antimicrobials before collection. This is another very, very, very common cause in a country like India, where empirical use of antibiotics is extremely common. And then we have plenty of non-culturable organisms. Most of the non-culturable organisms are going to be intracellular organisms. Like, for example, Rickettsia, Chlamydia, Bartonella, okay, Coxiella. So Coxiella is intracellular, Bartonella is intracellular. Then we have, as I said, the Rickettsia, Chlamydia, all of them are basically what? Intracellular organisms. So that's the reason why. So these are going to be non-culturable. So whenever the organism is intracellular, we tend to use specific techniques like PCR or probably antigen detection. We don't use cultures for those organisms, right?